surgical hand scrub is a systematic hand washing of fingernails, hands, and forearms before undertaking a surgical procedure. The purpose of surgical hand scrub is to remove debris and transient microorganisms from the nails, hands, and forearms, and also to reduce the resident microbial count to a minimum and inhibit rapid rebound growth of microorganisms. First, remove all jewelry from both hands and arms, then inspect your skin and nails. So ensure your skin is free of any cuts and wounds, and also the nails must not extend past your fingertips. And then, put on your personal protective equipment. To begin the scrub, tear open a sponge of your preferred hospital-approved antiseptic. Then, place the open pack above sink with a tear-facing ceiling. You must pre-wash your hands and arms only if this is the first case of the day, or if your hands are visibly soiled. Use the soap from the dispensers located within the scrub sink or in a separate container above the sink. Use the disposable nail pick and clean under running water, then dispose the nail pick in the trash can beside the sink. Rinse hands and forearms once hands and arms has been washed. Remove the sterile surgical sponge from the wrapper and moisten sponge under running water by squeezing and releasing it. With fingertips together, use a light but firm pressure to stroke the nail in a back and forth motion with the abrasive brush side of the sponge, approximately 30 times. The abrasive brush side is only used on your fingertips. The non-abrasive side should be used for the remainder of the scrub. Turn the surgical sponge over the non-abrasive side, then place fingers side by side including the thumb and scrub the surface of the palm 10 strokes, then turn the hand over and scrub the dorsal surface 10 strokes. Continue to apply 10 strokes to the other side of the thumb and each side of your fingers. Once you scrub an area, do not go back. Now that you scrub your hand, it is time to scrub your arm on the same side. Mentally divide the forearm into thirds from wrist up to 2 inches above the elbow. When scrubbing each third of your forearm, apply 10 strokes to the top, bottom, in the both sides of each section. Like before, once you scrub an area, do not go back. Repeat the scrub on the other hand and arm. Once both hands and arms are complete, discard the surgical sponge on the trash can beside the scrub sink. Start rinsing at your fingertips and continue to the hand, forearm, and elbow, moving in one forward direction through the water. Always keep your elbow at the right angle and hand raised at the level of your elbows. Do not move arm back and forth in the water. If you need additional rinsing, completely remove your arm from the water stream and restart at the fingertips until you reach your elbow. If you touch a non-sterile surface while rinsing, redo the entire scrub process with a new sponge. Once rinsing is complete and antiseptic removed on the hand and arm, turn off the water with the knee-foot control. To avoid contamination, keep hands above level of elbow and away from the scrub attire and non-sterile surface. Allow residue water to drift off the elbow and into sink. Do not shake or wave hands and arms to remove excess water. Walk backwards through the operating room door and dry hands and arms with a sterile towel before donning with a sterile surgical gown and gloves.